With the patient's health history in mind, and after good hand hygiene, you are ready for the physical examination. Begin by inspecting the anterior and inferior surfaces of the nose. Note asymmetry or deformity. Some asymmetry of the two sides is normal. Test for obstruction by pressing on each ala nasi in turn and asking the patient to breathe in.
Breathe in gently for me.
Then, tilt the head back, press gently on the tip of the nose, and shine a light into the vestibule to get a partial view of each nasal vestibule. To inspect the inside of the nasal passages, use an otoscope with the largest cap or speculum available. Be sure to insert the speculum carefully, avoiding contact with the sensitive nasal septum. Hold the otoscope handle to one side to avoid the patient's chin and improve your mobility. Repeat this procedure on the opposite side of the nose. Note the color and condition of the nasal mucosa that covers the nasal septum and the middle and inferior turbinates. Normally, the nasal mucosa is redder than the oral mucosa and displays no swelling, exudates, or bleeding. Note any deviation, inflammation, or perforation of the nasal septum. Look for any abnormalities, such as polyps seen in allergies, or ulcerations associated with use of nasal cocaine. Discard or clean and disinfect all nasal and ear specula appropriately. Conclude your examination of the nose by palpating for sinus tenderness. Press on the frontal sinuses from under the bony brows, avoiding pressure on the eyes. Then press up on the maxillary sinuses.